Marshman. I'm a podiatrist here at Pioneer Podiatry and Clinical Director. I'm going to talk today about a topic which is really interesting in podiatry at the moment, which is the topic of injectables for regenerative medicine purposes. So regenerative medicine is the practice of techniques that are to create a response in the tissue to heal itself. So it's about regenerating or tissue healing. When it comes to injectables, podiatrists are uniquely placed because they can do injections into the body that other therapists can't, and we, as podiatrists, we know that we're doing local anesthetic injections all the time. But now there are techniques that are quite specific for repairing tissues and provoking a repair or a regenerative response. So probably the most important and accessible product to use is Dextrose, which is a sugar solution essentially that we're injecting into the body for different responses. So we have sort of more standard prolotherapy techniques. So I like to use that for problems such as chronic plantar fasciopathy or Achilles tendinopathy. Also really helpful for ligaments that need repairing and aren't healing like they should. The purpose of that injection is to actually create an irritant in the tissue. So it's generally about 20% dextrose in sterile water, and that's going to create an irritant to the tissue to put it back through its inflammatory process, granulate, and then remodel. So there's various protocols with that. Another really interesting regenerative medicine technique is around the use of lower concentration dextrose for neurogenic pain. So there are various conditions that we as podiatrists see all the time that are worsened by neurogenic nerve irritation. So what it involves is very small and very superficial injections of 5% dextrose along the areas of pain, just subcutaneous, when we are getting what we're very sure is a neurogenic or a nerve-related pain. So a great example of this would be your plantar fasciitis patient who's got the obvious plantar heel pain in the fascia, but also has an area of red, swollen, and exquisitely tender, palpable pain up and on the medial heel along the course of maybe the calcaneal nerve or the medial or plantar nerve. So really effective, such a great tool to use for that kind of presentation. So hopefully this has been helpful to help you understand of some of the techniques that are out there at the moment for these kind of injuries. Now the training that's available is out there and we can give detail on that, but in-house in our own clinic we do this treatment, and we've got clinicians that are trained to provide this treatment. So that actually is part of our internship training for anyone who's interested in their first 2 years of practice to come in and doing our internship. That will be part of the training that you receive. So if you want to do these techniques that are really quite advanced and really, really helpful for patients. So thank you for watching. Hope this has been helpful.